Hi dear friends, welcome to Medical Destiny YouTube channel. Before watching this video, please take a moment to subscribe my channel. In this video, you will go through 25 Nclex-Rn nursing examination multiple choice questions and answers. Read the question by yourself and find the correct answer. Let's begin.
206. The nurse evaluates a client following treatment. For carbon monoxide poisoning, the nurse would document that the treatment was effective if which of the following were present. 1. The client is sleeping soundly. 2. The client is awake and talking. 3. The heart monitor shows sinus tachycardia. 4. Carboxyhemoglobin levels are less than 5%. Answer 4. Rationale. Normal carboxyhemoglobin levels are less than 5% for an adult. 0.05% to 2.5% for a non-smoker and 5% to 10% for a heavy smoker. Clients can be awake and talking with abnormally high levels. The symptoms of carbon monoxide poisoning are tachycardia, tachypnea, and central nervous system depression. 207. A nurse instructs a preoperative client in the proper use of an incentive spirometer is. Which does the nurse use to determine that the client is using the is effectively? 1. Cloudy sputum. 2. Shallow breathing. 3. Unilateral wheezing. 4. Productive coughing. Answer 4. Rationale. Incentive spirometry helps reduce atelectasis, open airways, stimulate coughing, and help mobilize secretions for expectoration, via vital client participation in recovery. Cloudy sputum, shallow breathing, and wheezing indicate that the incentive spirometry is not effective, because they point to infection, counterproductive depth of breathing, and bronchoconstriction, respectively. 208. A client is to be started on prazosin hydrochloride. Mini press. The client asks the nurse why the first dose must be taken at bedtime. The nurse's response is based on the understanding that during early use, prazosin 1. results in extreme drowsiness. 2. can cause significant dependent edema. 3. should be taken when the stomach is empty. 4. can cause dizziness, lightheadedness, or possible syncope. Answer 4. Rationale. Prazosin is an alpha-adrenergic blocking agent. First dose hypertensive reaction may occur during early therapy, which is characterized by dizziness, lightheadedness, and possible loss of consciousness. This can also occur when the dosage is increased. This effect usually disappears with continued use or the dosage is decreased. Options 1, 2, and 3 are not characteristics of the medication. 209. The nurse has applied the prescribed dressing to the leg of a client with an ischemic arterial leg ulcer. The nurse should use which of the following methods to cover the dressing? 1. Apply a Nclex roll and tape it to the skin. 2. Apply a large, soft pad and tape it to the skin. 3. Apply small Montgomery straps and tie the edges together. 4. Apply a cling roll and tape the edge of the roll onto the bandage. Answer 4. Rationale. With an arterial leg ulcer, the nurse applies tape only to the bandage. Tape is never used directly on the skin because it could cause further tissue damage. For the same reason, Montgomery straps should not be applied to the skin, although these are generally intended for use on abdominal wounds anyway. Standard dressing technique includes the use of cling rolls on circumferential dressings. 210. A child is admitted to the pediatric unit with a diagnosis of celiac disease. Based on this diagnosis, the nurse expects that the child's stools will be 1. malodorous, 2. dark in color, 3. unusually hard, 4. abnormally small in amount. Answer 1. Rationale. Celiac disease is a disorder in which the child has intolerance to gluten, the protein component of wheat, barley, rye, and oats. The stools of a child with celiac disease are characteristically malodorous, pale, large, bulky, and soft loose. Excessive flatus is common, and bouts of diarrhea may occur. 211. A clinic nurse is caring for a client with a suspected diagnosis of gestational hypertension. The nurse assesses the client, expecting to note which of the following if gestational hypertension is present. 1. edema, ketonuria, and obesity. 2. Edema, tachycardia, and ketonuria. 3. Glycosuria, hypertension, and obesity. 4. Hypertension, edema, and proteinuria. Answer 4. Rationale. Gestational hypertension is the most common hypertensive disorder in pregnancy. It is characterized by the development of hypertension, proteinuria, and edema. Glycosuria and ketonuria occur in diabetes mellitus. Tachycardia and obesity are not specifically related to diagnosing gestational hypertension. 212. A client who undergoes a gastric resection is at risk for developing dumping syndrome. The nurse monitors the client for 1. Dizziness, 2. bradycardia, 3. constipation, 4. extreme thirst. Answer 1. Rationale. Dumping syndrome is the rapid emptying of the gastric contents into the small intestine that occurs after gastric resection. Early manifestations of dumping syndrome occur 5 to 30 minutes after eating. Symptoms include vasomotor disturbances such as dizziness, tachycardia, syncope, sweating, pallor, palpitations, and the desire to lie down. 214. The nurse is caring for a client who just entered the emergency department. The client has a medical diagnosis of pneumonia and dehydration. Vital signs are blood pressure 76/40 seconds of a millimeter. Hg, heart rate 116 beats per minute, respirations of 22 breaths per minute with a pulse oximeter reading of 95% at room air and a temperature of 102.7 F. The nurse should perform the following prescriptions in which priority order. Number 1 is the first action and number 5 is the last action. Blank, obtain blood and sputum cultures. Blank, administer 1 L of 0.9 normal saline. Blank, insert a large bore needle intravenous. Catheter. Blank, administer acetaminophen Tylenol. 650 mg orally. Blank, administer sphazolin and Cef. 1 gram intravenous piggyback. IIVPB. Answer 3, 2, 1, 4, 5. Rationale. The priority is to obtain intravenous access and give fluid resuscitation. With the liter of 0.9 normal saline. The cultures are required next because they must be obtained before the administration of the antipyretic and antibiotic. The acetaminophen Tylenol is next because it is usually readily available via the medication administration system and will begin to take effect within 30 minutes. The antibiotic is then administered. It may take several hours to achieve an effect. 215. A client with heart failure was experiencing difficulty breathing and increased pulmonary congestion. The physician prescribed furosemide, Lasix, 40 mg to be given intravenously and it was given an hour ago by the nurse, which indicates the therapy has been effective. 1. The lungs are now clear to auscultation. 2. The urine output has increased by 400 milliliters. 3. The serum potassium has decreased from 4.7 MEq to 4.1 MEq. 4. The blood pressure has decreased from 118.64 mm Hg to 106.60 seconds of a millimeter Hg. Answer 1. Rationale. Furosemide, Lasix, is a diuretic. In this situation, it was given to decrease preload and reduce the pulmonary congestion and associated difficulty in breathing. Although all options may occur, option 1 is the reason the furosemide was administered. 216. Skin closure with heterograft will be performed on a client with a burn injury, and the client asks the nurse about the meaning of a heterograft. The nurse tells the client that a heterograft is skin from 1. A cadaver, 2. Another species, 3. The burn client, 4. A synthetic source. Answer 2. Rationale. Biologic dressings are usually heterograft or homograft material. Heterograft is skin from another species. The most commonly used type of heterograft is pig skin because of its availability and its relative compatibility with human skin. Homograft is skin from another human, which is usually obtained from a cadaver and is provided through a skin bank. Autograft is skin from the client. Synthetic dressings are also available for covering burn wounds. 217. The nurse is caring for a client admitted to the hospital after sustaining a head injury. In which of the following positions should the nurse place the client to prevent increased intracranial pressure (ICP)? 1. In left Sims position. 2. In reverse Trendelenburg. 3. With the head elevated on a pillow. 4. With the head of the bed elevated at least 30 degrees. Answer 4. Rationale. The client with the head injury is positioned to avoid extreme flexion or extension of the neck and to maintain the HAAD in the midline. Neutral position. The client is log rolled when turned to avoid extreme hip flexion. The head of the bed is elevated to at least 30 degrees or is recommended by the healthcare provider. Therefore, options 1, 2, and 3 are incorrect. 218. A newborn infant is diagnosed with esophageal atresia. The nurse assesses the infant, knowing that a typical finding in this disorder is 1. Slowed reflexes, 2. Continuous drooling, 3. Diaphragmatic breathing, 4. Passage of large amounts of frothy stool. Answer 2. Rationale. In esophageal atresia, the esophagus terminates before it reaches the stomach, ending in a blind pouch. This condition prevents the passage of swallowed mucus and saliva into the stomach. After fluid has accumulated in the pouch, it flows from the mouth and the infant then drools continuously. Responsiveness of the infant to stimulus would depend on the overall condition of the infant and is not considered a classic sign of esophageal atresia. Diaphragmatic breathing is not associated with this disorder. The inability to swallow amniotic fluid in utero prevents the accumulation of normal meconium, and lack of stools results. 219. The nurse is determining the need for suctioning. In a client with an endotracheal (ET) tube attached to a mechanical ventilator, which observation by the nurse indicates this need? 1. Clear breath sounds. 2. Visible mucus bubbling in the ET tube. 3. Apical pulse rate of 72 beats per minute. 4. Low peak inspiratory pressure on the ventilator. Answer 2. Rationale. Indications for suctioning include moist, wet respirations, restlessness, bronchi on auscultation of the lungs, visible mucus bubbling in the ET tube, increased pulse and respiratory rates, and increased peak inspiratory pressures on the ventilator. A low peak inspiratory pressure indicates a leak in the mechanical ventilation system. 220. A client is intubated and receiving mechanical ventilation. The physician has added 7 cm of positive end expiratory pressure (PEEP) to the ventilator settings of the client. The nurse assesses for which of the following expected but adverse effects of PEEP? 1. Decreased peak pressure on the ventilator. 2. Increased temperature from 98°F to 100°F rectally. 3. Decreased heart rate from 78 to 64 beats per minute. 4. Systolic blood pressure decrease from 122 to 98 mm Hg. Answer 4. Rationale. PEEP improves oxygenation by enhancing gas exchange and preventing atelectasis. PEEP leads to increased intrathoracic pressure, which in turn leads to decreased cardiac output. This is manifested in the client by decreased blood pressure and increased pulse. Compensatory. Peak pressures on the ventilator should not be affected, although the pressure at the end of expiration remains positive at the level set for the PEEP. Fever indicates respiratory infection or infection from another source. 221. The nurse is assessing the respiratory status of the client after thoracentesis. The nurse would become most concerned with which of the following assessment findings? 1. Equal bilateral chest expansion. 2. Respiratory rate of 22 breaths per minute. 3. Diminished breath sounds on the affected side. 4. Few scattered wheezes, unchanged from baseline. Answer 3. Rationale. After thoracentesis, the nurse assesses vital signs and breath sounds. The nurse especially notes increased respiratory rates, dyspnea, retractions, diminished breath sounds, or cyanosis, which could indicate pneumothorax. Any of these signs should be reported to the physician. Options 1 and 2 are normal findings. Option 4 indicates a finding that is unchanged from the baseline. 222. The nurse is preparing to administer a mantle. Skin test to a client. The nurse determines that which area is most appropriate for injection of the medication. 1. Dorsal aspect of the upper arm near a mole. 2. Inner aspect of the forearm that is close to a burn scar. 3. Inner aspect of the forearm that is not heavily pigmented. 4. Dorsal aspect of the upper arm that has a small amount of hair. Answer 3. Rationale. Intradermal injections are most commonly given in the inner surface of the forearm. Other sites include the dorsal area of the upper arm or the upper back beneath the scapulae. The nurse finds an area that is not heavily pigmented and is clear of hairy areas or lesions that could interfere with reading the results. 223. When assessing a client for possibly symptomatology of many back-Atresia disease, the nurse should ask which questions. Select all that apply. 1. Do you experience ringing in your ears? 2. Are you prone to vertigo that can last for days? 3. Can you hear better out of one ear than the other? 4. Is there a history of many back-Atresia disease in your family? Quote. 5. Have you ever experienced a head injury in the area of your ears? Answer. 1, 2, 3. Rationale. Many back-Atresia disease is characterized by dilation of the endolymphatic system by overproduction or decreased reabsorption of endolymphatic fluid. Manifestations include tinnitus, one-sided sensorineural hearing loss, and vertigo that can last for days. Although the exact cause of the disease is unknown, there does not seem to be a connection with either genetics or head trauma. 224. A hospitalized client is dyspneic and has been diagnosed with left tension pneumothorax by chest X-ray after insertion of a central venous catheter. Which of the following observed by the nurse indicates that the pneumothorax is rapidly worsening? 1. Hypertension. 2. Flat neck veins. 3. Pain with respiration. 4. Tracheal deviation to the right. Answer. 4. Rationale. Attention pneumothorax is characterized by distended neck veins, displaced point of maximal impulse, PMI, tracheal deviation to the unaffected side, asymmetry of the thorax, decreased to absent breath. Sounds on the affected side, and worsening cyanosis. The increased intrathoracic pressure causes the blood pressure to fall, not rise. The client could have pain with respiration. 225. A client is admitted to the hospital with a diagnosis of right lower lobe pneumonia. The nurse auscultates the right lower lobe, expecting to note which of the following types of breath sounds. 1. Absent. 2. Vesicular. 3. Bronchial. 4. Bronchovesicular. Answer. 3. Rationale. Bronchial sounds are normally heard over the trachea. The client with pneumonia will have bronchial breath sounds over areas of consolidation, because the consolidated tissue carries bronchial sounds to the peripheral lung fields. The client may also have crackles in the affected area resulting from fluid in the interstitium and alveoli. Absent breath sounds are not likely to occur unless a serious complication of the pneumonia occurs. Vesicular sounds are normally heard over the lesser bronchi, bronchioles, and lobes. Bronchovesicular sounds are normally heard over the main bronchi. 226. The nurse assesses the client with acquired immunodeficiency syndrome (AIDS) for early signs of Kaposi's sarcoma. The nurse observes the client for lesions that are 1. Unilateral, raised, and bluish-purple in color. 2. Unilateral, red, raised, and resembling a blister. 3. Bilateral, flat, and brownish and scaly in appearance. 4. Bilateral, flat, and pink, turning to dark violet or black in color. Answer. 4. Rationale. Kaposi's sarcoma generally starts with an area that is flat and pink that changes to a dark violet or black color. The lesions are usually present bilaterally. They may appear in many areas of the body and are treated with radiation, chemotherapy, and cryotherapy. 227. A client is suspected of having a pleural effusion. The nurse assesses the client for which typical manifestations of this respiratory problem. 1. Dyspnea at rest and moist, productive cough. 2. Dyspnea at rest and dry, non-productive cough. 3. Dyspnea on exertion and moist, productive cough. 4. Dyspnea on exertion and dry, non-productive cough. Answer. 4. Rationale: a pleural effusion is the collection of fluid in the pleural space. Typical assessment findings in the client with a pleural effusion include dyspnea, which usually occurs with exertion, and a dry, non-productive cough. The cough is caused by bronchial irritation and possible mediastinal shift. 228. A client with pleural effusion had a thoracentesis, and a sample of fluid was sent to the laboratory. Analysis of the fluid reveals a high red blood cell count. The nurse interprets that this result is most consistent with 1. Trauma, 2. Infection, 3. Liver failure, 4. Heart failure. Answer 1. Rationale: pleural fluid from an effusion that has a high red blood cell count may result from trauma and may be treated with placement of a chest tube for drainage. Other causes of pleural effusion include infection, heart failure, liver or renal failure, malignancy, or inflammatory processes. Infection would be accompanied by white blood cells. The fluid portion of the serum would accumulate with liver failure and heart failure. 229. A nurse is scheduling a client for diagnostic studies of the gastrointestinal (GI) system. Which of the following studies, if prescribed, should the nurse schedule last? 1. Ultrasound, 2. Colonoscopy, 3. Barium enema, 4. Computed tomography. Answer 3. Rationale: when barium is instilled into the lower GI tract, it may take up to 72 hours to clear the GI tract. The presence of barium could cause interference with obtaining clear visualization and accurate results of the other tests listed, if performed before the client has fully excreted the barium. For this reason, diagnostic studies that involve barium contrast are scheduled at the conclusion of other medical imaging studies. 230. The nurse is caring for a client who is scheduled to have a liver biopsy. Before the procedure, it is most important for the nurse to assess the client's 1. Tolerance for pain, 2. Allergy to iodine or shellfish, 3. History of nausea and vomiting, 4. Ability to lie still and hold the breath. Answer 4. Rationale: it is most important for the nurse to assess the client's ability to lie still and hold the breath for the procedure. This helps the physician avoid complications, such as puncturing the lung or other organs. The client's tolerance for pain is a useful item to know. However, the area will receive a local anesthetic. Assessment of allergy to iodine or shellfish is unnecessary for this procedure, because no contrast dye is used. Knowledge of the history related to nausea and vomiting is generally a part of assessment of the gastrointestinal system but has no relationship to the procedure.